Today we will focus on retinal tumors, including retinoblastoma, uveal melanoma, retinal astrocytoma, optic nerve glioma, hemangioblastoma, retinal lymphoma, retinocytoma, vasoproliferative tumors, combined hamartoma of the retina and RPE, diffuse infiltrating retinoblastoma, retinal capillary hemangioma, and retinal metastasis. Retinoblastoma is a malignant tumor that affects the retina, primarily occurring in children. It arises as a result of mutations in the RB1 gene, leading to uncontrolled proliferation of retinoblasts. One of the key diagnostic features is leukocoria, commonly known as the white pupil. To manage retinoblastoma, a multidisciplinary approach involving oncologists, ophthalmologists, and radiation specialists is essential. Treatment options include chemotherapy, local therapies such as laser photocoagulation, cryotherapy, and radiation therapy. In some cases, enucleation may be necessary. Close follow-up and genetic counseling are crucial due to the hereditary nature of this tumor. Uveal melanoma, another form of ophthalmic tumor, arises from the pigment-producing cells within the eye. Patients may present with visual disturbances, ocular pain, or even asymptomatic. A comprehensive evaluation involving ophthalmoscopy, ultrasound, and imaging studies is necessary for accurate diagnosis. Treatment options for uveal melanoma depend on the tumor size, location, and extent of metastasis. They range from local treatment options like brachytherapy, thermotherapy, and transpupillary thermotherapy to surgical interventions such as enucleation and exoneration. In advanced cases with metastatic spread, systemic therapies and targeted therapies may be employed. In the video titled Optic Nerve Glioma, Characteristics, Diagnosis, and Treatment, we will delve into the features, diagnostic methods, and treatment options for optic nerve glioma, a type of brain tumor that affects the optic nerve. Medical Student 3, Professor, can you explain the molecular mechanisms and targeted therapies for hemangioblastoma? Professor, absolutely, let's dive into the next topic. Retinal lymphoma is a rare form of non-Hodgkin lymphoma that affects the retina. Diagnosis involves a comprehensive ophthalmic examination along with additional tests such as optical coherence tomography and fluorescein angiography. Treatment involves a multidisciplinary approach including systemic chemotherapy, intravitreal chemotherapy, and radiation therapy. Close follow-up is essential for monitoring response and detecting recurrence. Summarize in 15 words. Retinal lymphoma presents with subretinal infiltrates, retinal vasculitis, or vitreous opacities, posing diagnostic challenges due to overlapping features with other ocular conditions. Retinocytoma is a benign tumor of the retina. Distinguishing retinocytoma from malignant retinal tumors involves understanding its unique characteristics. Treatment options depend on tumor size, location, symptoms, and visual acuity. Observation, laser photocoagulation, vitrectomy, anti-VEGF injections, cryotherapy, radiation therapy, or surgical resection may be used. Regular monitoring is crucial. We will discuss the clinical features, diagnostic methods, and management options for this rare tumor. By understanding its characteristics, you will be better equipped to diagnose and treat patients with this condition. Medical Student 4, Professor, can you provide an overview of retinal detachments and their management? Professor, of course. Retinal detachments occur when the retina separates from the underlying tissue, resulting in vision loss. There are three main types: rhegmatogenous, tractional, and exudative. Rhegmatogenous retinal detachments occur due to a tear or hole in the retina, which allows fluid to accumulate beneath it. Treatment typically involves sealing the tear and reattaching the retina through surgical procedures like pneumatic retinopexy or scleral buckling. Tractional retinal detachments are caused by fibrous bands in the eye pulling on the retina. These bands usually form due to conditions like diabetic retinopathy or proliferative vitreoretinopathy. Surgical intervention, such as vitrectomy with membrane peeling, is often necessary to release the traction and reattach the retina. Exudative retinal detachments involve the accumulation of fluid beneath the retina, usually due to conditions like age-related macular degeneration or central serous chorioretinopathy. Medical Student 10, thank you, Professor. Can you explain the management of retinoblastoma with orbital involvement? Professor, treating retinoblastoma with involvement of the orbit is complex. The treatment approach depends on the extent of the tumor and whether it has spread outside the eye. For cases with limited orbital involvement, local therapies such as plaque brachytherapy or external beam radiation therapy may be used. These can be combined with systemic chemotherapy to control the tumor and preserve vision. In more severe cases, where the tumor has extensively invaded the orbit or has metastasized, more aggressive treatment options may be necessary. In the 12th topic, metastatic tumors to the retina, identification and multidisciplinary management. We will cover the methods for detecting primary tumors that have spread to the retina and the collaborative approach in managing such cases. In summary, this section focuses on the identification of primary tumors that metastasize to the retina and the multidisciplinary approach required for their management. Diagnostic strategies and treatment options are discussed, emphasizing the importance of collaboration and surveillance. In conclusion, different types of retinal tumors were discussed, including their features, diagnosis, and treatment. Collaboration and research are essential for improving patient care. Thank you for watching.